So this event today that we are organizing is basically a meeting of all these 7 partners of PENUP to discuss the various activities that has taken place in past 2 years, and also to sort of collectively think about what next.
We're evolving the objectives, taking on information from our partners, from the stakeholders, to refine the goals. But the original goals that we laid down, I think, are pretty much still in place. And that's to form a network that is pro-poor, that embraces One Health concepts, but is essentially targeting increasing the use of participatory approaches. And to do that, we want to use research both on how to advance the methods, how to validate the methods, but also research on how to apply these methods to new problems. And we also want to have a good capacity building activity where we take the information to new groups, and working with the human health partners is really a process in evolving the models and training approaches to incorporate a broader community.
People are different in every region, every nation, and to an extent every village. And therefore the capacity development strategies that we design has to be tailor-made according to the stakeholder that we are working with. And we have tried and designed the PENUP capacity development efforts in a way to sort of handle this challenge.
Using PE tools, it changes life from the trainer or the practitioner to the people you are communicating with, the people you are training. And the tool always helps us to understand how community deal with problems. And when they deal with the problem, where can we intervene as an outsider?
We think that this network and the approach, the participatory epidemiology approach it's trying to promote, will help to improve disease surveillance, and that's what is very important. And we have seen with emerging diseases and with diseases with high impact on human health like avian influenza, we all have seen the importance of getting involved in this type of approach, which is risk-based.
Responding to the situation.
What we're doing is really about adding another set of tools to an existing set of tools, and thereby contributing towards our ability to provide better disease surveillance.
We need to demonstrate where this has had a positive impact. We need to look backwards at where it's been used and learn lessons from where it has not been as successful as we would like. And we need to put this together and get it out into the general knowledge base that we have so that other people can tap into this and decide whether or not this would be appropriate for them to use in their surveillance systems.
The network that we are having, so the PENUP, is an excellent forum because the partners involved come from different sides and have different views and experiences. And of course I have tasks that come from my organization and its mandate, but you need to place that in a broader context, and I am very happy to have this network, to have a discussion forum with very skilled people, very motivated people also, that want to move forward, that want to implement this new methodology and make it available to anybody who needs it.
What's new about PENUP for us is that we see an opportunity to validate some the approaches in participatory epidemiology, and at the same time with that we see an opportunity to institutionalize participatory epidemiology, particularly in institutions of higher learning, the universities, and within the national veterinary services across the continent.
We train professionals, veterinarians or technicians in different countries. The big thing is keeping them involved. You know, they go off back to the district, so they need to feel that they're part of a bigger thing, so part of this network.
But we definitely need to have other sorts of forums where the broader community is involved. And along those lines, at the moment, we have a community of practice for people who actually do participatory epidemiology and membership at that level.
PENUP and its partners took a lot of efforts to have a clear description or even scientific data on what does it really mean and what it is for. And I think this network has to continue to validate this methodology and to show with data and case studies and real-world examples what it can be used for, and of course also what are the limitations, which then would lead to policy changes at a later stage.
Now we are talking about Asia, we're not talking too much more on Africa, and we also think that this approach is not only for developing countries, but it's for Western countries also.
There is still a lot of potential to enlarge our network, to think about how we would make it broader in terms of the people interested in the PENUP, the network itself, but also in the methodology of participatory epidemiology. How can we link all these different aspects to make it a whole, an entire thing that allows to solve the challenges that we are facing? And I think we are now in the phase of trying to validate these methodologies and to put them in a setting to show to a greater public and to the professionals involved in health and animal health how it can be used.
Quite important. Position papers which go into the peer-reviewed literature. So again, and that is also ownership, because we as a group then own this publication, and it actually links us together.
Some very important questions have come up in terms of how far do we try to push PENAF next? How much contact and collaboration do we want to have with the public health community at this time? And for me, a very important question is, how can we test or how can we validate the scientific integrity of this technique, of this methodology?
Having doctors on our board, having Human Health Organization as core partners of the organization was one of our initial ideas. We have achieved some good progress, and currently we hope that AFINET, the African Epidemiology Network, will join the organization.
Trying to collaborate with AFINET.
Participatory stuff has been very much vet-focused thus far, even though community-based things have been very human-focused, and I would actually like to see an integration of the two, a broadening of the definition, because I think there's lots of great work that's been done by people who are using different words to describe it.
I think we need to communicate clearly the role of the PENUP in order to make it known, in order to get funding, in order to maintain it, and to be able to conduct this research and to be able to achieve our objectives, basically. So I think the next big step is about communication.
We develop a lot of concepts and small projects and case studies, and some of them have already been implemented, and it's very promising, and I feel like this network has to go on.